update now on respiratory viruses circulating in our area and affecting children in particular. RSV is a big one, and it's concerning many parents right here in Western Mass.
We're learning doctors are seeing walking pneumonia symptoms or even a combination of RSV and other respiratory illnesses. Western Mass News reporter Daniel Santiago joins us live in studio after getting answers from a local pediatrician for us. Daniel, what did you find out?
Well, Chris, Abby, Dr. John Kelly, a pediatrician at Redwood Pediatrics, tells me he is seeing a lot more patients with RSV symptoms, and he says prevention is still key in fighting the virus.
Respiratory syncytial virus, or RSV for short, is back, causing more babies and adults over 65 to get sick and go to hospitals. In Western Mass, pediatricians are seeing more cases, and the winter season has not officially begun. One of them is Dr. John Kelly at Redwood Pediatrics in East Longmeadow.
So this is the season for RSV, and we're seeing a whole lot of it. A lot of kids with, upper respiratory viral infections, cough, runny nose, some fevers. And the thing with RSV is that can cause lower viral respiratory infections, so that gets into your lungs.
Dr. Kelly tells Western Mass News most young patients get better within days, although there is one main challenge that comes with getting sick with RSV.
There is no medications to give to cure it once you have it. It's all supportive care.
The respiratory virus usually presents with symptoms that can be easily confused with a common cold. But according to the Centers for Disease Control and Prevention, a parent should take their child to the emergency room when they notice them heavily struggling to breathe, having trouble swallowing liquids, or when you observe a suction-like contraction around the ribcage when they try to take a breath. Dr. Kelly tells us right now there are children with walking pneumonia, a less serious version of the virus that usually involves a lasting cough and flu-like symptoms. He says 80% of the kids with walking pneumonia develop the virus as a result of first having RSV, while the remaining 20% of the cases are usually attributed to bacteria, which can be treated with antibiotics. For RSV, Dr. Kelly tells us there are two options to best prevent getting sick, especially for infants 8 months or younger. One of them, a new monoclonal antibody shot.
That monoclonal antibody, the studies show that it decreases hospitalization by 80%. So that's huge in the pediatric world. That will significantly decrease admissions to a hospital during the RSV season. But having said that, there's a shortage and we can't get it right now. So the company that produces this monoclonal antibody underestimated the demand that was going to be there, because this is a game changer.
The second option for prevention, a vaccine given to expecting mothers to help pass down antibodies to their babies.
That's another way. So that's something that anyone out there who's pregnant and they're going to deliver during RSV season, which is typically like September to March, please ask your OB about getting the RSV vaccine and for the sake of your infant.
Dr. Kelly says that RSV shot for pregnant women will also last longer in the babies, which means no extra shots will be needed once the baby is born. He also tells me he's hoping the vaccine rollout for winter of 2024 won't be as slow as this year. Reporting live in studio, Daniel Santiago, Western Mass News.